Hi, this week's video is a very exciting one for me because I know it is a subject of interest that matters to you. I am back with Dr. Susan again, women's midlife wellness and care. She focuses on bioidentical hormones. I'm going to link our first video together because the response to that was phenomenal. We covered, I think, Hormones 101 in the first video.
It was a lot.
It was a lot. Hormones, sexuality, midlife, all of that. But I'm here specifically because it's time for me to do a pellet insertion. I'm due for a hormone and I'm getting testosterone. And so a lot of you may think, well, wait a second, you're a girl. What are you doing with testosterone? And I want Dr. Susan to talk a bit about why women in midlife can really benefit from testosterone and not just estrogen and progesterone alone.
Yes, and that's such a great topic. I was brought up, like most of us, to think that testosterone was for men.
Sure.
And estrogen was for women. But actually men have both and women have both. They're just in different levels. In fact, it's interesting that women actually make more testosterone throughout our lives than estradiol, but these are things that we're not taught even as physicians. So when we go through menopause, we lose all three hormones, estradiol, progesterone, and testosterone. In traditional hormone replacement, the way I was trained, we were trained just to replace estrogen, maybe not even progesterone, but really just focused on estrogen.
Correct.
And then over the past 15, 20 years, it's really become clear that testosterone is so important to live our optimal best lives, which I think is what we all want.
Sure.
So
talk about those benefits because they're really important to women of this age.
Well, I'll tell you my personal story. I went through menopause earlier than I was expecting. I was around 47. I'm 54 now, by the way. And at that time, I was traditionally trained still. I hadn't really learned much about bioidentical hormone replacement because we don't get taught that as physicians. We talked about that last year. We don't get taught anything. So I was taking estradiol and progesterone.
Right.
I felt pretty good. I felt maybe 80% good, but I still had no sex drive. And my muscle mass was decreasing. I'm really athletic, and I was finding, I was doing my workouts and I wasn't as strong. I could see my arms getting flabbier and the little tire around the middle.
Right.
So I knew there was just something missing. And so I just set out to find out what else could be done. And when I started taking testosterone myself, just a low dose. Now, I don't have a beard, I don't have acne, I don't have any of the things that we worry about. What happens without testosterone, ladies, is starting at about 25, it slowly decreases. So we don't want to have the testosterone that a man has, but having a little bit of testosterone, because mine was actually 0 when I measured it. Now, when I measure most of our patients' testosterone, it's 0 or very close. That does not feel good.
Nope.
When I started taking testosterone, within 2 weeks, my sex drive was improved. Within a couple of months, I noticed more muscle mass on our body composition machine. And as an athlete, I noticed I was stronger. I had more energy. I slept better. My skin was really dry. Now, we don't want oily skin, but I've had the same esthetician for years. And when I went to see her, she said, my gosh, what products are you using? Your skin looks so much better. I got a little bit of that healthy oil back, which is good for fine lines. So. We worry about acne and oily skin, but the good side of that is we can get a little bit of healthy oil in our skin. So we need all three hormones, ladies, to feel optimal. Estradiol, testosterone, and progesterone. The key is just that they're given in the right doses. The only problems we have is when you get too much.
Yes, and so how do you determine how much is enough?
Yeah, and that's the
magic bullet,
big question, right? So we have a little calculator. They give us some help. And for example, it's weight-based, so we would take your weight and your starting testosterone levels. Mine was very easy because it was 0. And then a dose would be suggested for that patient. Now, I actually never start with that dose. I always start a little bit lower because we never know if someone might be more sensitive to the hormones than the average person. So starting a little bit lower, I think, is key, and that's why we have such a low side effect profile in our practice. So if you got too much, for sure, you could have those side effects like acne, hair growth, even hair loss, stuff we don't want.
Right.
Now, worst case scenario, that would wear off, but we're trying to help you to feel better, not worse. So I think it's key to find a provider that knows the dose that's appropriate for each individual patient. We don't give the same dose to each patient.
Right.
Your dose would be different than mine or anybody else's. And then start a little bit low because we can always increase it. But one of the things that people worry about with pellets, which I worried about myself, is that they do last for 3.5 months. So if you have side effects, you might have to put up with them for a while. So we definitely don't want to deal with that. So lots of experience. Honestly, a little bit of trial and error. I'll say I gave myself a little bit too much a couple of times. And then just learning that less is more. You know, just like I say all the time, salt in soup. A little bit of salt's great, too much, you ruin it.
You ruined it. That's a good analogy. Okay, so we're going to head into one of your offices and you're going to do an insertion on me. Don't show too much butt, but that way everybody
But
can
it's
see
so cute.
I don't know about that. I'm 54. But anyway, we'll see what it's like, and it's painless, and the beauty is, just like you said, it lasts 3.5 months.
Yeah, that is really nice. Just makes
Yeah.
life a little bit easier. Now, can I mention one special thing
Yes.
about you? Now, this is something that you can choose to do just to illustrate how it's not the same for every person.
Right.
I had this issue too. I'm very sensitive to estrogen.
Yes.
And you are too.
Yep.
So sometimes if we put estrogen in the pellet, which we can, even at the lowest dose, some patients will have breast tenderness, even bleeding. These are really annoying side effects.
Yes.
So some patients choose to just get testosterone in the pellet. That's something I've chosen to do.
Me too.
Yeah, I mean, you can get estrogen if you want to, but so it's all customizable. You don't have to
Right.
follow a cookie cutter recipe. In fact, you shouldn't. We want to listen to the patient and give you exactly what you need. So today we're doing just testosterone only.
Okay.
So just before we place this pellet, why do some people get testosterone only? Really quickly, when you get testosterone, you also do get some estrogen because there's a process called aromatization, which just means some of the testosterone converts into estrogen. And for a lot of women, that's enough. So some people are really sensitive to estrogen, like myself and Dominique. I can get breast tenderness and other symptoms, so I prefer just to get the testosterone. Or if we do get into some trouble with our estrogen being a little low, we can always use an estrogen patch or something different. So there's a lot of different options. You can get both estrogen and testosterone in the pellet, or you can just get the testosterone only. So we're about to do it. Let's have her come on in.
So I'm ready. I've got my dress on, and Susan has me draped, and she's got the spot ready to go. And we've got 2 cameras so you can see my perspective as well as what she's doing. Ready?
All right, yay.
Okay.
So this is the setup for pellet placement. Kind of looks like we're doing a big operation, but really we're not. It's just making sure we keep everything clean. So I've got my gloves, my sterile cleansing things, tiny little poke with a scalpel, and I'm going to show you how it all works. This is where I need to put on my reading glasses because, you know, I'm 54. And I want to be able to see what I'm doing.
Please see.
So, you know, Dominique had mentioned she's had this done before. We've actually had fun. We've done this at her house, and that is something that I do. I do it at home for people who like to do that. So it's I don't know if you can even see, but the previous mark where the pellet was placed is practically invisible.
Yeah.
I mean, I have to really look closely to even see it. It just looks like a teensy little mark because it's literally only 2 millimeters in size. It's very, very tiny. But I'm going to go right through that same mark because I always hate to put more than one mark on anybody's skin. Now, if you were somebody who ultimately were going to get pellets over and over, we would go, you know, one side and then the other side and back and forth. But you don't need more than 2 incisions because we don't want to create little polka dot situation. Now, anyone who's got Botox knows what a Botox needle is. This is a 30 gauge needle. It's a teeny, teeny, tiny needle. But lidocaine, which is what's in this little vial, does sting a little bit for all of us who've been to the dentist. So the only part about this that hurts is that it stings for about 5 seconds. So Dominique, here's the little sting, little ouchie, 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 and then we just talk about the weather and count to 5, 1, 2, 3, 4, 5, and then it's not going to hurt anymore.
That's nothing.
Yeah. So what do you think? It's not even like a bee sting, right?
Yeah,
It's just,
not even.
and it's a teeny, teeny needle.
Right, and then
Now-
it immediately goes away.
Now, normally the patient can't see this part, but I'm going to put a little bit more local anesthetic into the channel where the pellet goes, which is actually about 2 inches away from where the tiny little incision is going to go. This is a tiny bit bigger needle, but she's not going to feel it because it's already numb right here. So I'm going to go right through that numb spot and then just numb that. Dominique doesn't really have much fat, but the little bit that she has, we're numbing just to make sure she doesn't feel anything. And that's the extent of everything that hurts. So how is that?
Piece of cake?
Yeah.
Honestly.
So now it won't hurt anymore. So, you know, some people don't like watching any type of procedures. So this, you can see it's not bleeding at all. It's a tiny little scalpel. I'm literally going to make a little 2 millimeter poke in the skin. It's just teeny, teeny, tiny. And again, I'm going right through that old scar. I don't know if you can see that with the camera, but look how small that is. It's, if you had a freckle removed at the dermatologist, it would be bigger.
Really?
Than this. Yeah, it's teeny, 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 teeny. Now, Dominique, when you can eventually watch this video, you'll be able to see this. The thing
I
is,
know, I've never seen that perspective before. I'm so curious.
Patients have never seen their own pellet being placed. When I talk to patients, I tell them this is a hollow needle. Now, actually, in medical terms, we call it a trocar because it does look a little bit scary, but it's actually it stretches through the skin. So you might feel some pressure. I'm just burrowing it through that tiny little incision. It just burrows underneath the fat, and you can't feel that at all, right?
Not at all.
You might see it has a little channel right there. That little channel is where the pellets are going to go. So we calculated Dominique's dose exactly for her. And this is actually a dose that we've used before, so we know that it works. You can see I'm actually placing 2 pellets because they're kind of like Lego blocks. They come in all different doses, and you can add them together to come up with the perfect dose for the patient. So in her case, it's 125, which is 2 different little pellets. Push them in, and that's it. So that's done. Now this tiny little mark, we want that to be invisible, so you can see it's really not bleeding at all. But I'm going to use a little bit of this is our magic sticky glue. Put a little bit on each side. And then most of you know what steri strips are. You might have used them if you have kids, if they have a little cut on their face or what have you. So we just put a little steri strip over it. Now, because of that sticky glue, that's going to stay on there for about 3 days, even with showering. That's all we need to do. Honestly, if I didn't cover it at all, it would be just fine. But, you know, we try to be perfect. Now, just so she can shower and exercise, I'm going to put a clear cover over everything, just so that we don't get any blood on her pretty dress. This is a little bit unnecessary, but I like to do it anyway. This is an occlusive cover. It's just like sticky saran wrap. And that's it. So I keep this cover on for 48 hours. That way you can shower. I've actually even swum with mine on. You're not supposed to do that really, but it does stay on even when it gets wet. There are some rumors. In fact, some providers say that you shouldn't exercise for a day or 2. You can exercise. It's not in the muscle. You can go to the gym today. You can do normal activities. That's it. So in 2 days, she's going to take all of that off. And there you have it. That's what a pellet placement's like.
Okay.
How was it?
Nothing.
Yeah, and I could have done it twice as fast if I wasn't talking through it. You know, I wanted to mention something that I forgot to say, which is in the past few years, we have found through lots of studies that testosterone actually decreases breast cancer risk. So add that to all the other benefits. Osteoporosis prevention, it's great for heart health, it lowers cholesterol, decreases breast cancer risk, libido, energy, muscle conservation, tons of benefits. So I'm all for it, and it doesn't hurt.
At all, and I'll be back to see you in 3.5 months.
Yay, awesome.
Thank you.
My pleasure.